If you're interested in beginning testosterone replacement therapy, it's important for you to understand that testosterone is only legally available in the United States by prescription from a licensed physician or healthcare provider. There's many available physicians that can help treat low T. Usually, endocrinologists and urologists are a good place to start, but whoever the physician is, you want to make sure that not only are they licensed, but experienced in the field of hormone replacement therapy, as not all physicians are knowledgeable in this area of medicine. A physician consultation will take place. You'll usually discuss your past medical history, as well as the signs and symptoms that have led you to this point where you want to discover whether or not testosterone replacement is right for you. A blood test is also going to take place where your free and total testosterone will definitely be checked, as well as a few other blood markers to determine if TRT is appropriate. It's important that you find yourself a competent physician who's not just trying to sell you on some expensive bill of goods. The Better Business Bureau and Google ratings will offer you some valuable insight, but one of the first things to look out for is whether or not the doctor actually discusses the pros as well as the cons. It's easy for a physician to discuss just the positives and the benefits of TRT, but if they are not willing to discuss the possible side effects, then that's a giant red flag that you should look out for. To learn more about testosterone replacement therapy or to schedule an appointment, visit us online at www.novagenics.org or give us a call to schedule a consultation today.